C. difficile infections. Introduction. C. difficile is a type of bacteria that can cause diarrhea and infection of the colon. This bacterium is more likely to infect patients at hospitals and other healthcare institutions. It is estimated that C. difficile affects tens of thousands of patients in the United States every year, resulting in about 5,000 deaths. Patients and healthcare providers can do a lot to prevent C. difficile infections. This patient education tutorial explains what a C. difficile infection is. It discusses its causes, symptoms, diagnosis, and treatment. It also gives tips about how to prevent a C. difficile infection from happening in the first place. Background info, bacteria, and antibiotics. This section reviews important terms and concepts that will help you understand C. difficile infections. Germs are all around us. There are millions of them in the air and on our skin. Viruses and bacteria are examples of germs. C. difficile is the name of a bacterium known as Clostridium difficile. It is often abbreviated C. diff. Many parts of the body specialize in fighting germs. All of the germ-fighting parts of the body together make up the immune system. Sometimes germs can get past the immune system's defenses and cause infection and inflammation. If the immune system does not win the fight against an infection, the infection could spread to the blood and other parts of the body. If not treated, these infections could be life-threatening. Scientists have developed antibiotics to fight bacteria. Antibiotics are not good at fighting viruses, such as the flu virus. Antibiotics come in different types and strengths. Some antibiotics kill some bacteria, but not others. Sometimes antibiotics kill bacteria that compete with C. diff in the colon, but do not kill C. difficile. This makes it easier for C. diff to grow. Viruses and bacteria keep changing their structure through a process called mutation. Scientists call these new mutated germs strains. New strains of germs can become more resistant to antibiotics. If the new strains are more resistant to antibiotics, they become difficult to fight and more dangerous. However, we may give longer courses of the treatments or combinations of antibiotics for the newer C. diff strains. C. diff infections. C. diff is a very common bacterium. Its spores can be found in the earth, feces of animals, and humans. Spores are the dormant form of the bacterium, and they can live on the surfaces of objects for a long time. The majority of people get the C. diff spores when they fail to wash their hands before eating. The acidity of the stomach destroys many of the spores. If any reach the intestines, they are controlled by the immune system. However, the immune system may not kill all the tough C. diff spores. Some of them remain dormant. The intestines have hundreds of bacteria, many of which have useful functions, such as helping to stimulate the immune system and produce vitamins. When C. diff spores exist in the colon, the other bacteria do not allow them to grow and strive. Some antibiotics kill the bacteria that C. diff competes with. This makes it easier for C. diff to grow. Exposure to almost any antibiotic can put one at risk for C. diff. When it grows, C. diff secretes poisonous substances known as toxins. These toxins spread in the digestive system and cause the formation of tissues that look like membranes. They are called pseudomembranes or false membranes. This is why C. diff infections are also called pseudomembranous colitis. If people become sick and their immune system is weakened, it becomes easier for C. diff infections to spread. That is why C. diff is common in hospitals and nursing homes, where many patients and residents are weak from sickness or surgery. Other medications used at hospitals can also make it easier for C. diff to grow. This includes chemotherapy medications, antiviral, and antifungal medications. The longer these kinds of medications or antibiotics are used, the more likely it is for C. diff to grow and cause a serious infection. Patients at hospitals and other healthcare facilities are much more likely to get C. diff infections than healthy people because they are more likely to be on antibiotics and their immune system is more likely to be weak. Complications.